Good morning. Having completed the section on paraphilias, we now move on to the section on gender dysphoria. Let me begin with explaining what gender dysphoria means. Gender dysphoria is a discomfort with one's sex-relevant physical characteristics or with one's assigned gender. That is, these individuals experience marked incongruence between one's experienced or expressed gender, that is, how one feels about himself or herself, and their assigned gender, that is, their biological sex. This term, the term gender dysphoria, has replaced gender identity disorder. That is, this particular disorder was called gender identity disorder in DSM-4-TR, but the term gender dysphoria has replaced the term gender identity disorder in DSM-5. This is because nearly all individuals with gender identity disorder certainly experience gender dysphoria, but whether this is due to atypical gender identity is not very clear. Gender dysphoria is experienced at varying degrees in different individuals, so therefore it is consistent with the dimensional approach, and the same degree of incongruence that is experienced may fluctuate over time within the same individual, and this is important for us to understand. Okay, this is how you see gender dysphoria in childhood. Boys with gender dysphoria show a marked preoccupation with traditionally feminine activities and are often ostracized as sissies by their peers. And girls with GID are distinguished from tomboys, girls who generally show a lot of strong preference to dress like boys, and show preference for masculine activities and sports and all of that. But however, tomboys and girls with gender dysphoria can be distinguished on the basis of the strong desire that these children with dysphoria experience or express to be a boy or grow up as a man. And cross-gender behavior, as you all know, in girls is much better tolerated, and for this particular reason you see a lot of boys with gender dysphoria coming in for treatment than girls. I have listed DSM-5 diagnostic criteria for gender dysphoria. I have listed 8 symptoms in criterion A1, out of which 6 symptoms will have to be present for the diagnosis of gender dysphoria. And in all of this you see that the person experiences a strong desire to be of the other gender, or an insistence that one is the other gender, and the condition has to be associated with clinically significant distress or impairment in social, school and other important areas of functioning. Okay, so this particular slide talks about what happens to these children when they grow up into adults. Do gender dysphoric children become gender dysphoric adults as well? So several research has been carried out in this particular to answer this particular research question, and it has been found that the most common outcome for boys with gender dysphoria has been homosexuality rather than transsexualism. That is, one study that was done in the year 1987 showed that out of the 44 feminine boys from the community, only one sought sex reassignment surgery, that is, they wanted to become a transsexual at the age of 18. About 3/4 became gay and bisexual men who were evidently satisfied with their biological sex. However, later studies showed that the percentage of people who become transsexuals are a little higher, about 10 to 20%, and about 40 to 60% identified themselves as homosexuals or bisexuals. And with respect to girls, there were several smaller prospective studies of girls with gender dysphoria, and they have shown that about 35 to 45% show persistent gender dysphoria. That is, if they show that incongruence as a child, it persists into adolescence and therefore adulthood, and approximately half had homosexual orientation as well. However, one large prospective study showed that the percentage may not be this high, and it showed relatively lower rates of persistent gender dysphoria. Many such children typically adjust well in adulthood. So, therefore, there was this debate as to whether there should be these children should be called as disordered, because the primary obstacle that these children face seems to be societal intolerance to cross gender behavior. But however, some research has pointed out to the distress that these children and adolescents face about the discrepancy between their biological and their psychological gender. So, and therefore, this warrants to be called as a mental disorder. Some There are studies which also shows that stigmatization of these gender non-conforming children are not universal, and in some parts of the world cross-gender behaviors are much tolerated and they are seen like the third gender. So when you look at children coming from such backgrounds where parents are more accepting of such cross-gender behaviors and other things, these children do not recall experiencing distress per se. So now, without the distress, should we again call this as a disorder? And because of this, many people have argued that it should not even appear in DSM-5. But despite these objections, the diagnosis has been retained as gender dysphoria in children. So this is important for us to understand. Treatment. Children and adolescents with gender dysphoria are not generally brought in by their parents, because parents are not comfortable with their boys and girls behaving in the opposite way. So the specialist now tries to treat the child's unhappiness with their biological sex and ease the strained relationship with parents and peers. Children with dysphoria often have general psychological and behavioral problems such as anxiety and mood disorders that also require therapeutic attention. Focus is also on reducing cross-gender behaviors, especially in situations where it might cause interpersonal problems. That is, these children, when they behave typically very feminine, boys who behave typically feminine, or girls who behave extremely masculine in situations where in social situations, can put the parents in a very embarrassing situation, and and therefore the parents are quite unhappy about it. So all this, the specialist kind of trains them to reduce such cross-gender behaviors in interpersonal situations. So this could reduce the strained relationship that these children experience with parents. Treatment is also done psychodynamically, wherein their inner conflicts can be examined, but control studies establishing the validity or evaluating whether such treatments are good enough needs to be done more. And if the child will eventually transition into the other sex, it is beneficial to prevent sexual maturity from occurring in the original unwanted sex. That is, if a girl child wants to become a male, or if a boy child has to become a women, then it is better to prevent sexual maturity happening in their original biological sex. Thus, in progressive Netherlands, under some circumstances, gender dysphoric early adolescents are given hormonal treatments to delay puberty while they decide how to proceed. So, in this particular context, two related facts about gender dysphoria in children are especially important clinically. First, it is to be noted that not all gender dysphoric children become gender dysphoric adults. The problem generally remits during adulthood. That is kind of they lose the intensity. That, as I told you, they vary in intensity, and they vary in intensity in the same individual over time. So when they transition into adolescence, a child who has gender dysphoria may not experience gender dysphoria. So second, individuals who are still gender dysphoric into adolescence are likely to remain so into adulthood, and they are more likely to take medical steps to transform their bodies. So the crucial age at which somebody decides to or gender dysphoric children desist or persist appears to be between 10 and 13. That is, whether they continue to have these gender dysphoric feelings, or whether they become adjusted is evident between ages 10 and 13. So increasing number of parents and gender dysphoric children but nowadays we do see a lot of parents who are cooperating with these gender dysphoric children, and therefore one of the outcomes that can happen as a result of this increased cooperation or increased acceptance among parents is that many of them can become transsexual adolescents and adults. But however, one positive thing could be that these children could experience less distress about having such incongruences, but the outcome but it could lead to increased outcome of many of these gender dysphoric children developing transsexualism or becoming transsexuals. So that brings us to the end of this video. Thank you.